Chapter 41, Care of Patients with Sexually Transmitted Infections. The term sexually transmitted infection, or STI, refers to specific infections spread by intimate physical contact. Modes of transmission will include sexual intercourse, contact with genitals, the rectum, mouth, blood contact, and with the fetus, it will be via the placenta or a newborn during the birth process. Pelvic inflammatory disease, or PID, refers to any inflammation in the pelvic cavity. If the infection is in the fallopian tubes, it is called salpingitis. Infection of the ovary is called oophorytis. Infection of the pelvic peritoneum is called pelvic peritonitis. This is the most common reproduction complication in fertility, and this is from damage to the fallopian tubes. The patient will routinely appear ill. Chronic PID can cause symptoms such as backache, a feeling of pelvic heaviness, and disturbances in menstruation. Candidus is caused by a change in the vaginal pH. This allows yeast-like fungus, Candida albicans, to grow. The pH of the vagina can be altered by diabetes mellitus, oral contraceptives, systemic antibiotic use depending on the medication, or frequent douching. Bacterial vaginosis occurs when the normal lactobacillus in the vagina is replaced by Mycoplasma hominis, or anaerobic bacteria. Bacterial vaginosis can increase the risk for sexually transmitted infections and does have serious consequences if it occurs during pregnancy. This is associated with minor vaginal tissue trauma that is often caused by frequent sexual activity or douching. Biologically, young sexually active women have a large proportion of columnar epithelium lining the cervix and the vaginal pH that can be altered by frequent douching. The mucus plug in the cervix of women that protects the upper genital tract becomes more permeable around the menstrual period. This can result in an increased risk during this time for infections in the upper GI tract, like pelvic inflammatory disease. The use of oral contraceptives alters the cervical secretions, resulting in a more alkaline environment in the vagina, and therefore a more favorable setting for the growth of organisms that can cause sexually transmitted infections. Sexually transmitted infections can have long-term effects on the reproduction in the form of sterility, complicated pregnancy, or neonatal infection. Gardasil 9 provides protection against HPV types 6 and 11. This causes genital warts, and Gardasil 9 will protect against HPV 16 and 18. This is the cancer-causing strains. Cervarix, which is another HPV vaccine, provides protection against HPV types 16 and 18 only. Both vaccines are highly efficacious against cervical, vaginal, vulvar, and anal cancers. These are well-tolerated vaccines and they are considered safe. Either of the vaccines needs 3 doses to be effective. The nurse teaching the parents of 7 to 11-year-old girls about HPV vaccination should include which statements? The vaccine is a one-dose immunization. The vaccine prevents genital warts. The vaccine prevents precancerous lesions of the cervix. The vaccine protects against other full-blown HPV infections. The vaccine eliminates the need for routine cervical cancer screening. The correct answer, 2, 3, and 4. Lesions for sexually transmitted infections will vary depending on the gender. There can be lesions around the mouth. Lesions of syphilis will include a classic rash on the palms of the hands and the soles of the feet. Gonorrhea can spread and cause pustules on the extremities. Syphilis, whether primary, secondary, or congenital, gonorrhea, and chlamydia are all examples of current reportable sexually transmitted infections, according to public health guidelines from the Centers for Disease Control and Prevention. The impact of disclosing the diagnosis of sexually transmitted infections warrants specific nursing responsibilities that include recognizing a false positive reading, providing emotional support, ensuring accuracy of laboratory request slips, checking specific restrictions or preparations, providing expert advice. The answer is 1, 2, 3, and 4. Sexually transmitted infections are primarily passed through some type of intimate contact, genital to genital, mouth to genital, or genital to rectum, and these can occur in all types of sexual relationships. Some infections, like HIV or hepatitis B or C, can also be passed through blood contact by sharing of contaminated needles, or, rarely today, through transfusion with contaminated blood. Accidental transmission to healthcare personnel can occur with needle or sharp injuries, or by direct exposure to open wounds or body fluids. Bloodborne infections may be transmitted to a fetus before birth. Newborns are at risk for contracting any STI that may reside in the vagina at the time of birth. Depending on the organism, the exposure can lead to a variety of serious problems for the infant, including pneumonia and blindness. Some states, screening for STIs, especially syphilis, is required for a marriage license. A variety of tests are used to detect sexually transmitted infections. Non-invasive diagnostic techniques that use urine samples have been developed. Smears and cultures may be taken directly from the site, vaginal, cervical, or urethral swabs. Sometimes organisms may also be cultured from the blood. Biopsies are microscopic tissue examination that are performed on a sample taken from an affected area and are usually done to differentiate between benign and malignant tissues. However, these can also provide a differential diagnosis for diseases that have specific cellular changes or organisms present. Numerous types of blood tests can help detect STIs. They look for specific antibodies that are formed by the presence of certain microorganisms or for the effects of antigens. These effects include the tendency for agglutination, which is the clumping together of cells in a variety of characteristic patterns. Staining procedures differentiate organisms by using dyes that have been found to stain some bacteria in specific ways. A gram stain would be an example. In this procedure, bacteria are first stained with crystal violet, then treated with a strong iodine solution, decolorized with ethanol or ethanol acetone, and then they are counterstained with a contrasting dye. Those that retain the initial stain are considered gram-positive. Those that lose the stain but accept the counterstain are considered as gram-negative. Nurses help provide information to prevent sexually transmitted infections. It is taught in sex education class to adolescents. Nurses will counsel individuals that are at specific risk. They help to identify asymptomatic infected individuals. They will evaluate, treat, and counsel sex partners of patients who are infected with an STI. And they do follow-up of treatments that are at risk or currently undergoing treatment.